First of all, gallstones are really common, and the majority of people with them wouldn't know they have them and spend the entire length of their life with gallstones that don't cause them symptoms. There are three main types of stones. There's cholesterol stones, which is due to cholesterol being excreted by the liver, and they concentrate the cholesterol and it forms cholesterol stones. And these are yellow. When we do a gallbladder operation, we see them and they're nice little yellow stones. You can get bile pigment stones, and bile is nature's fairy liquid. And so when you have quite concentrated bile, they can crystallize out and cause gallstones. And then there's mixed stones that have cholesterol and bile salts, and those are called mixed stones. Gallstone symptoms are generally related to the stage of your gallstone disease. So biliary colic is the first stage, and that's where gallstones can cause pain by intermittently blocking the outflow of the gallbladder. So patients generally would say that they get a pain in the right side of the abdomen just below the rib cage, or sometimes patients get pain in the upper middle part of the abdomen. Patients often report that the pain goes round through to the back or even into the right shoulder, and that's called radiation, and that's a very common symptom. Some people just get the back pain, and that's actually quite rare, but one of those reasons why back pain should also be investigated. Why do we get these pains? Well, in the textbooks say that it's often related with fatty foods, but actually in my experience, it can be any foods, and some people just get it when the gallbladder wants to create pain. The pain usually lasts 30 minutes to several hours, and then it completely subsides, and then patients feel absolutely normal in between attacks. So that's called biliary colic. A more severe form is called cholecystitis, and this is infection or inflammation in the actual gallbladder itself. And this is a more constant pain. It's a pain that starts on the right, it often goes through to the back, and is associated with quite an intense, constant pain that most people would need to go and seek medical attention for because it lasts more than 24 hours. Often it's associated with a temperature, and so patients often come into hospital and have intravenous antibiotics, and most people would end up needing to have their gallbladder out if they've had cholecystitis. Surgery is recommended for gallstones in two main ways. If you've had an infection in the gallbladder and you've had cholecystitis, then the NICE guidelines recommend that you have your gallbladder out to prevent you from getting cholecystitis again, and that can be a life-threatening condition, and so that's a really good guideline recommendation. Also, if you've had gallstone pancreatitis, that's inflammation of the pancreas gland, then all the guidelines suggest that you have to take the gallbladder out to prevent any further pancreatitis. And pancreatitis can be a life-threatening condition, and so if you've had pancreatitis caused by gallstones and you're fit enough for surgery, then everybody would recommend that you have a gallbladder removal surgery to prevent you from getting it again. The second type of patient that needs their gallbladder out is the biliary colic patient. These are the patients that get intermittent abdominal pains caused by their gallstones, and they last for several hours and then it subsides, and these are the patients that feel normal in between, and sometimes they wonder whether they need to have their gallbladder removed. What I normally say to these patients is it's very much dependent on the type of symptom you get, the severity of the symptoms, how often you get them, and whether you can control it with low-fat diet. In about 50% of patients, a low-fat diet might control your symptoms enough that you can avoid surgery. And certainly I recommend that often for the first time when I see a patient with biliary colic, because it's very much a lifestyle choice. If the biliary colic symptoms give you pain every time you eat, then actually it makes sense to take your gallbladder out, because you will be able to eat and drink what you want without any more pain. If, however, you get pain once or twice a year and actually you manage it on your own with paracetamol and you don't really need to come into hospital, then actually taking your gallbladder out might be a step too far, and I would normally recommend that we would watch and wait. So it's very much dependent on what the patient feels and whether they want to have the gallbladder removed because it's the right time for them. One of the things that we don't think about is if you have pain or you're abroad or somewhere where there isn't very good healthcare. And that's one of the questions I often get asked is, would you have your gallbladder out so that I can go on holiday and not worry about it? And actually, that's also a really good reason. If you're somebody that does travel a lot and you don't want to have an attack of gallstones in a foreign country where the healthcare may not be as good, then taking your gallbladder out would be a reasonable thing to do. The modern management of gallstones is with keyhole surgery and lately robotic surgery to remove your gallbladder, and both techniques use the same keyholes that are put through the abdominal wall. So it's usually with 4 ports or 4 little keyholes, and from those 4 little keyholes we can do the whole procedure. We disconnect the gallbladder from the bile duct and the liver, we put it into a small bag and we actually pull it out through the belly button port. It can take between 30 minutes to an hour, and for patients that have symptoms from their gallstones, this will get rid of that pain for them and allow them to enjoy life and food as and when they want. In terms of risks, all surgery have risks, and the first 4 risks are the same as any operation that you might have: anesthetic, bleeding, infection, and blood clots. And we have something in place to stop all those things from happening. You get special boots to wear to stop you getting blood clots, and if you stay overnight, you get a little injection to thin your blood so that your blood's nice and thin and you don't form clots. In terms of infections, we get antibiotics intravenously during the operation, so there's always antibiotics going around the system to prevent sepsis. In terms of specific risks for gallbladder surgery, there's about a 5% risk that we can't do keyhole surgery in patients with gallbladder problems. And this is usually because of previous surgery that they may have had, or indeed they've had multiple attacks of infections and inflammation in the gallbladder, and it's all really stuck to surrounding structures. And actually proceeding with keyhole surgery may be dangerous in those cases. And so we would open the patient up and make a bigger cut to allow our hands to get in and to be able to extract the gallbladder safely. The final risk is a theoretical risk of about 1 in 400 that we can damage the bile duct when we do this operation. Now, in my practice, before I do any cutting of any organ, I actually inject the bile duct with an X-ray contrast dye, and I take an X-ray on the table in theatre. This lights up your bile duct, it lights up the junction with the gallbladder and the liver, so that I'm able to extract your gallbladder safely without damaging your bile duct. Because for me, that's a really important thing to prevent, and for patients, it's really peace of mind knowing that I'm doing that. And that's in my routine practice, and something that not many surgeons go about doing because it's a bit fiddly and adds time onto your operation. But for me, I guess it helps me sleep at night. So most patients, when they've had their gallbladder removed with keyhole surgery, would go home the same day, and that's called a day case procedure. You come in the morning, you have your procedure, and you go home in the afternoon. And most patients are up and about straight away and walk out of the hospital and recover at home. Some patients maybe who have got cardiac problems, heart problems, chest problems, or a little bit frail would usually stay overnight and go home the following day, or indeed if there's nobody at home with you, we would keep you overnight so that you've got somebody looking after you, and that gives you peace of mind. In terms of longer term recovery, most patients who are working age would get signed off for 2 weeks, but in my experience a lot of people who have desk jobs go back to work after 1 week, and I've had 3 chaps go to work the next day, but they were self-employed and I guess a bit more motivated to work. In terms of longer term recovery, you're allowed to eat and drink what you want immediately afterwards. So there are lots of false claims on the internet that you have to adhere to a special diet or a gallbladder diet. This isn't necessary at all, and the majority of patients go back to eating and drinking what they want and what they enjoy. Some patients find that it's difficult to digest really fatty meals straight away after an operation, and certainly with gallbladder removal surgery, you don't have the injection of bile, extra bile that you need for really fatty foods like fish and chips or a pizza. And so you might have some stomach upset and diarrhea in the first few weeks after the operation, but actually the majority of patients eat and drink what they want without any problems. I would normally see my patients 6 weeks post-operatively to make sure that everything's gone right, check your wounds, make sure that there are no hernias, and also to give you any final advice before you're discharged. The majority of patients, I've cured their pain, they enjoy their food, they can go out to restaurants and enjoy holidays without that anxiety that they're going to get any more attacks. Once you've removed the gallbladder, you're not going to form any new stones because you haven't got any gallbladder. However, some patients can form new stones in the bile duct, and this is about 1 in 100,000. It's very rare. It's usually elderly patients who have got a very dilated common bile duct, but this is very much a minority of patients. Because I do the X-ray test called a cholangiogram, I actually check for any stones in your bile duct during the operation. So you've got peace of mind that there are no stones in there and that you won't develop any new ones because I will have flushed any of them out. So that's something that I do extra. For me, it helps me sleep at night, and for you, it's peace of mind that there's nothing anywhere else.